Hi, everyone. Good afternoon. Welcome. My name is Wendy Kaj, and on behalf of the Chaplaincy Innovation Lab and our wonderful collaboration with the Fetzer Institute, I'm really pleased to welcome you today to this webinar. I'm thrilled to be joined by some wonderful guests with whom we're going to be in conversation about the current and future state of chaplaincy and spiritual care. And to kick us off, Michael Skaggs will introduce the panelists and give everyone a few tech tips, and then we're going to go from there. Michael.
Thank you. So for today's technology, all that you need to worry about is if you would like to ask questions, there is that function on the control panel on the right-hand side of your screen, so you can put questions into that box. We'll hold those until the very end, but we do have, they all stay right there, so we're not going to lose them. Your question will be there. This session is being recorded, so if you need to leave early or you missed something or whatever, don't worry. We will send a link out to the recording once it's available online afterwards. Also, within that email that will have the link to the recording is a link to a survey about your experience of the webinar. We want to have your feedback, what you thought about the presentation, the technology, all of that sort of thing. So please do check out that survey. Everything is anonymous, but if you would like to be entered into a drawing for an Amazon gift card, there's a little box in there for your email address, and we can do that as well. So that's the technological side. Let me turn now to the more important people, our guests. So Allison Kestenbaum is the CPE Program Supervisor and Palliative Care Chaplain at UC San Diego Health, where she has developed a palliative care specialty accredited by ACPE. She conducts research about spiritual and palliative care, patient care, and education, and was the first chaplain, this is a point of pride for everybody, the first chaplain to receive a Cambia Health Foundation Sojourn Scholar Leadership Program Award in 2018. Prior to what she is doing now at UC San Diego, she was Director of Programs at the Center for Pastoral Education at JTS in New York, and was previously Chaplain Supervisor at UC San Francisco Health. Thank you for being with us today, Allison. Eric Skidmore is a native of Montreat, North Carolina, where his family has lived since 1965. All right, so deep roots in North Carolina. He attended UNC Chapel Hill and graduated in '83 and served for 2 years in Washington, D.C. with the Boy Scouts of America, and then went to Union Theological Seminary in Richmond, Virginia, where he earned a Master of Divinity, and then answered a call to serve on the staff of Eastminster Presbyterian Church in Columbia. He was there for 7 years and earned a Doctor of Ministry degree from McCormick Theological Seminary, and has since been parish associate on the staff of Forest Lake Presbyterian Church since 1998, where his wife is also the senior pastor, which I think makes Eric her subordinate there at Forest Lake Presbyterian. But most importantly for today, in 1997, he was hired by the South Carolina Law Enforcement Division to create a new program called the South Carolina Law Enforcement Assistance Program. And he's the program manager for that program. It's a partnership between several organizations in South Carolina that have very long acronyms, but it's important to know that it is a collaborative effort in South Carolina among state agencies for the state police. So welcome, Eric. Thank you for joining us. Reverend Kirstin C. Boswell-Ford is Associate Dean of Student Support Services at Brown University. She served in congregational ministry for almost 20 years and is an American Baptist clergy person holding an MDiv from the University of Chicago Divinity School. She's currently completing her PhD also at Chicago, where her writing focuses on womanist theology and analyzing the call narratives of African American clergy women. Thank you, Kirstin, for being with us today. And then finally, LeSette Wright. Dr. LeSette Wright is a chaplain, professor, and public health advisor. She is the founder of Peace Seekers, an organization devoted to cultivating partnerships for preventing violence and promoting God's peace. She is the first African-American woman to be ordained to ministry from the historic Tremont Temple Baptist Church in Boston, and founder of the Community Chaplaincy Collaborative that served in the aftermath of the Boston Marathon bombing. Dr. Wright has worked internationally to enhance the violence prevention efforts of cities, advising government, academic, community, and faith-based stakeholders on effective and sustainable public health efforts, providing pastoral care and counseling with survivors of homicide victims, and training clergy, educators, youth, families, and communities in the significance of trauma, spirituality, and resilience. She currently resides in Berea, Kentucky, where she serves as college chaplain for Berea College. So with that, I will turn it over to LeSette, who is going to get us kicked off with a brief moment to center and then right into the discussion. Thank you, LeSette.
Thank you, Michael, and good afternoon, everyone. Welcome. Let us center in prayer. Dear God, as we open this conversation today, we do so in gratitude and humility. We pray for sustained indignation for the social ills in our land and acknowledge the role that we play therein. Give us a sacred restlessness and empathy that drives us to pursue peace, liberty, and justice for all. We know that Black lives matter to you, and we will not rest until they matter to all. Allow our chaplaincy and spiritual care to reflect this truth, and may those who come behind us find us faithful. Always and in all ways we pray. Amen. My deepest gratitude to the Chaplaincy Innovation Lab and Fetzer Institute for the opportunity to participate today in this timely and necessary conversation. We come together today in the midst of the COVID-19 pandemic, as well as the pandemic of racism. Both of these diseases impact the spiritual well-being of individuals, communities, and nations. As spiritual care providers, we endeavor to engage in this conversation with our fingers on the pulse of our nation, the globe, and our very own beings. This is indeed a tall order, and one that calls us to examine our field, the discipline of spiritual care, while acknowledging where we are and where we need to go. Personally, I engage in this conversation through the lenses of my identities and academic disciplines. As a Christian, African-American, heterosexual woman, I am passionate about mental health, public health, and spiritual health and wellness. I acknowledge that these lenses inform my sharing today, as well as the way in which I navigate the world. My chaplaincy and spiritual care service has encompassed the local church, community and disaster response chaplaincy, and college chaplaincy. So as we engage today, everyone, in this roundtable on chaplaincy and spiritual care, in conjunction with the release of the ebook through the Chaplaincy Innovation Lab, there are 3 areas that I'd like to submit for our consideration today. And they are increasing diverse chaplaincy and spiritual care landscape, understanding the convergence of our diverse people groups, spiritual practices, cultures, etc. The need to review pathways to chaplaincy and spiritual care service, training and credentialing. And thirdly, to increase our attention to and literature base on chaplaincy, spiritual care, trauma, and resilience. As you know, pandemics, natural disasters, and other deeply distressing disturbances and crises are challenging our spiritual well-being and holistic health at its core. Much of the literature shows that chaplaincy and spiritual care is an important factor for resilience. As we consider these areas and others today, I just wanted to submit as our framework for your consideration that Apple and others are currently working on some problems they've been having with facial recognition software. And the problem is that the software simply has difficulty recognizing Black faces. And what that brings to mind for me is that the facial recognition programs were not created with Black faces in mind. And so as we consider the field of chaplaincy and spiritual care, as well as our other systems that we have created as human beings, we have to always go back to the place where we ask, who created these systems and who did they have in mind when they created them? So in framing our conversation today, this is at the backdrop of our topics that we're discussing. Thank you.
Thank you, LeSette. That's terrific and really helpful.
All right.
We've asked each of the panelists to talk for a few minutes this morning to sort of share with us what is on their mind and their hearts in this time as we think about the history and future of chaplaincy and spiritual care. So we're going to do a bit of a round robin here, and then we'll come back and take as many of your questions as we can. As Michael mentioned at the beginning, this whole conversation grows out of a conversation a group of about 20 or 25 of us had at the Fetzer Institute in collaboration with them in December. And that's where the ebook came from. And the goal of that was to really just begin to think big and figure out how to think about what the vision is, but then, you know, bring the practicalities and the pieces down to help the Innovation Lab as we continue to be of support to all of you. So thank you, LeSette, and let me turn it to Kirsten.
Good afternoon. Thank you to Wendy and Michael and all those who are affiliated with the Chaplaincy Innovation Lab, which has just been a wonderful project to be involved with. And thank you also to our friends at the Fetzer Institute. It's a great honor to be here this afternoon, and I'd like to just jump right into my thoughts about why this is such a timely conversation. You know, as Dr. Wright mentioned, we are in the midst of multiple pandemics. You know, the healthcare crisis with COVID-19, the disease of racism, an economic crisis. And I think that we could all, you know, add on additional thoughts in terms of other ways in which society is being greatly impacted in this particular time in multiple negative ways. And I think that as a result of the time that we're living in, it's clear that the need for support in areas that are traditionally deemed the areas of religion and spirituality, the need for support in those areas is higher than ever now. You know, for so long, for so many years, we've been given data about the numbers of Americans who are turning their backs on religion. Many are familiar with the term nuns, meaning those who are who do not ascribe to traditional forms of religion, and that the numbers of nuns are continually rising in our society. But I think that that conversation, and research is showing this, that conversation needs to be much more nuanced, because it's not so much, I believe, that people are turning their backs on religion. I think they're clearly not turning their backs on the questions that religion seeks to answer. I think that they are perhaps turning away from some of the more traditional expressions of religion and looking for new and innovative ways to seek the answers to the questions that still persist. Fear and trauma and grief, you know, our place in the world, our relation to each other and to the cosmos, those are questions that I think that until the end of time, humankind will be seeking answers to. And so I think that this journey for answers begins to take on a new form. And now what it is beginning to look like, as research is showing, is that more and more Americans are turning to chaplains. Research that was done by the Chaplaincy Innovation Lab shows that in the past 20 years, or in the past 2 years, at least 20% of Americans have come into contact with a chaplain in their quest for these types of conversations and answers. So this conversation about the future and direction of chaplaincy is incredibly relevant, given all of these factors that I've just addressed. Contributing to the conversations at Fetzer with the Fetzer Project and this ebook, I think has been helpful in allowing me to sit with and to interrogate some of the commonly held ideas about chaplaincy that in my own journey as a chaplain, a higher education chaplain over many years, the things that have perhaps been a bit of a rub for me as my role continued to morph and to change. And I think that one of those things that I would like for us to focus some conversation on today is specifically how chaplaincy can begin or continue to shift more towards a demand-centered model. I think that that's crucial to this field, and would love to hear the audience's questions on this, as well as my co-panelists' thoughts on it, and also the ability of this field to be nimble and shift more rapidly in response. So it really ties into the first point about the demand-centered model, but I think that one of the attributes of chaplaincy is that because it's probably more able than some of the more traditional religious spaces, more able to shift rapidly and be more nimble in response to the needs that are presented in the world. I hope that chaplaincy is moving in a direction that is in tandem with the natural progression of humanity, where we're going, where we're all going. We're all on a journey together. And I believe that chaplains have a dual-pronged obligation to be both a source of support as well as almost an example. I mean, I'd be happy to unpack that more, though I won't do so now. But a space of support and a space of example as humankind continues to follow its trajectory. And so I think that this demand-centered model that I feel very invested in is really a way in which this field can continue to be relevant and to live into that dual-pronged role that I think that it has. Thank you.
Thank you. Allison?
Great. Thank you. Well, it's certainly an honor to be together with this panel. Just huge appreciation to the Chaplaincy Innovation Lab and the Fetzer Institute. And always just when thinking about the present and the future, just always thinking about my teachers and mentors and students and patients who are my biggest mentors and teachers, and just how they are helping to shape the thoughts that I have about what we're talking about today. So something that I'm seeing, and I think we saw this when we gathered together back in December, and we've been seeing it for a while, is that chaplains have a tendency to move in and out of the spaces where there is need and suffering. I don't think that's ever going to change, and that's where a lot of my hope is, meaning that, you know, even if a system or an institution doesn't make the space for chaplains, that we will find ways and places to serve in the community. And I don't think that that's something that can be said of every profession. There's just great fortitude there. So that gives me a lot of hope. And just to see, you know, a concrete example of that in all this has been the explosion of telechaplaincy over these past few months, which was something that had existed prior, but just other ways that technology is being used. So I think definitely as we think about the future, technology is a part of it. And I'm going to talk a little bit more about diversity as well, but I really am hopeful that technology can help, you know, it bends space and time in certain ways, so it can bring together people who may normally not be able to learn and serve together. And so I'm really hopeful about that. So I acknowledge that chaplaincy does and exists in all kinds of settings. We see that in this gathering today. We saw that in December at the Fetzer Institute, and I think we all know this. And to some extent, the wherever. I even had a conversation last week where I learned about a new corner of chaplaincy in my own state that I hadn't even realized, right? So at times it can feel overwhelming, but I think that part of what Chaplaincy Innovation Lab is leading is this great experiment of, can we be more coordinated? All chaplains everywhere. And I'm not really sure what's going to happen, but I really want to be a part of that experiment. And I think many of us do, and I'm sure that we will have, there's going to be a lot of ups and downs. And but I would say that, I'm just really interested in seeing where this continued conversation and coordination can go. Speaking of where we're going, when I this opportunity to come together and think about these things, I literally came from San Diego, dropped my family off in New York back in December, took a flight to Chicago, and then ended up in Kalamazoo to be at the Fetzer Institute for this gathering, which is really kind of like out of the way. But I mentioned that to say that that's how exciting and rich this all is, because of the people that are involved and who the people were at the table, who they were representing. So we may have had 20 people there, but it was, dozens and dozens more of that. And so the more that we can have these kinds of opportunities, I know we're limited in getting together in person, but finding ways of gathering and touching folks that we might not otherwise is incredibly important. So I will say that in terms of just getting really concrete, I'm speaking from the healthcare setting. I'm in an academic medical center, spending a lot of time in palliative care. So I can't speak for all of those designations, but I'll, but know that that's informing some of where I'm coming from. Just to give you start with a little bit of a vignette on this point, which is, I recently had my annual performance evaluation, which is something that most of us have. And normally I would use it as an opportunity, to negotiate advancement. And this is not a time to negotiate advancement. I mean, I'm fortunate enough to have employment in my chosen profession, right? So what I did instead was I said, what can we do to make an impact in our institution, right? So what is it that administration and staff from other disciplines and the patients who come to seek our care, who are consumers, I say in air quotes, what is it that we can do? And to really ask that in a pointed way to administrators, right? So particularly to my manager, but to others, and to be really proactive about that right now. It reminded me, actually, when I started thinking about it, is that it's not so different than what's taught about perspective taking, right? So we see that in some of the psychoanalytic world and trauma response, and actually it's recommended for to address moral injury, but that we would look at the perspectives of and it goes both ways, right? So I'm not suggesting that those that are in a traditionally oppressed situation take the perspective of those in the power of authority and just accept it, but that it truly is something that goes all ways. And that's something I want to encourage us to do as chaplains as we look forward, that certainly our mission and the calling and the content of the work that we do is incredibly powerful. And I don't think we should ever have to, package it or tone it down in any way for whoever our audience is, being an institution or administration or that kind of thing. But I think that it really does align with some of the greatest needs that we're seeing, at least I can say in healthcare. I think probably other fields in chaplaincy as well. So that's really something that I would like to see. And that was not an inherent skill for me. That was something I had to learn to do, and I'm still growing in that. But I think it's something that chaplains are not necessarily taught to do as part of their profession, as part of their ministry, even, I would say. So that's something that I'm, hoping to see more of. And, in our case, really just supporting staff, the moral injury of staff and the fatigue of staff to help them care for patients is one of the biggest areas where there's opportunity right now to help heal. And then one other thing I'll just say before I turn it over to Eric. So I think continuing to ask the question of who is at the table and who is missing from the table every single time we gather at a table, right? Every time that there's any planning or any visioning happening or any reflecting, right? And so, while I'm not, an example, for me is here in San Diego, the Latinx community, right? So I'm not an expert on this, but at least, you know, it's apparent to me that where the gaps are in my institution or in our training program, and even just having a Spanish-speaking chaplain, you know, on staff, right, or in our internship program, that these kinds of things, that makes such a difference. And to be aware of the health disparities that we're certainly seeing, you know, with COVID-19 in our local community here, but I know that that's all over the world. So I would say another question, and this I think really ties in with what others have said, but that we look at our spheres sort of influence, right, to advocate for wherever we can support diversity. So, you know, a CPE training program is my focus to a large extent. And I'm just really thinking about what adjustments do we make? You know, if there are systemic barriers to accessing chaplaincy education, there just is, you know, so how can we continue to address those and be really proactive about that in concrete ways, and not in a, you know, dysfunctional rescuing kind of way or whatever, you know, that we are holding people accountable, that there's integrity to it, but we are going the extra many miles. You know, one example of that is just in our advisory group, right? So when I came to town and we started setting up this program, I was new to San Diego. I asked around and said, who should be on this advisory group? And all of the responses I got were predominantly Christian chaplains. And so I asked again, and I asked specifically, you know, to represent, to ask about diversity. And I felt very, I wasn't sure if I was supposed to do that, if that was okay to do. And I'm also open to feedback about that. But just to actually to have specifically asked the question in that way yielded, you know, our table to be so much more diverse. And of course, there's always more work that we can do than that we are doing. But just to really, you know, lift that up in every opportunity that we possibly can. Thank you, and I look forward to the rest of our conversation.
Super, thank you, Allison. Let me insert, just because I see some of the questions coming in about what is a demand-centered model, and we can have a much longer conversation about this. But I think it's basically the idea that a lot of our conversations historically about chaplaincy and spiritual care have focused on how chaplains should be trained, what certifications they should have, whether they should do CPE, et cetera. They focus a lot on how to supply chaplains. And I think the idea of being more demand focused is trying to begin to understand where there is a demand for chaplains and how chaplain services are received, to try to make sure that the supply that we've put a lot of time and energy into trying to improve is actually meeting the demand on the ground. There are other ways we could frame this in terms of being consumer focused. People are sometimes not comfortable with that language. Being person centered, trying to think about how to sort of assess the effectiveness of what we're doing and work backwards and start from the demand side rather than from the supply side. There's a lot of critiques to it. We can have a bigger conversation, but just in terms of like what that phrase means, that I think is what people are mostly referring to. Eric, you're up. Wait a minute, Eric, you're still muted. Hold on.
Eric, see if maybe unplugging your headphones has an effect. That might do it for us. Still nothing. Eric, I'm going to send you a message in chat with my phone number if you want to call me, and then we can hand it back to Wendy for some questions in the meantime.
Okay. All right, perfect. We'll figure it out. So there are actually lots of questions coming in. I'm really happy to see so many questions. I'm just going to move through them as best I can. And since we were just talking about the demand-centered model, I wonder if I might ask the panelists if they want to say more about how they understand the demand-centered model, if it's helpful, or how. One critique that came in is, I could just read it. One of the fears I encounter when talking about chaplaincy privileging demand as a criteria for training, formation, and theory is that chaplaincy will become even more a handmaiden of empire. The history of chaplaincy, of course, is closely related to the ways religious institutions have been co-opted to support and validate political, economic, and social power. What are some of the safeguards to minimize this potential in becoming more demand-driven? Another person wrote in and said, basically, demand is endless. How could we ever even begin to meet it? Do any of you want to think out loud a little bit about those issues?
I'll say a word or two about that. Those are very good questions, and I think that one of the key points that I'd like to stress is that we're just really beginning these conversations. So, you know, all of the feedback that can be received on this particular model and other questions will be, you know, as helpful as we try to figure this all out. But the way I see the importance of a demand-centered model, when you think about trying to match the supply to the demand, is that it can go hand in hand with you know, what some of my fellow panelists have talked about in terms of the need for increasing diversity when we look at chaplaincy. When we look at the people who are reaching out for, in need of chaplaincy care, if we start thinking about the folks who are actually supplying that that care beginning to look like and you know, be more in line with those who are in need, then I think that we automatically begin to move away from the more empire-centered model and move towards a space of increased diversity of thought, of race, of gender, of all types of diversity.
Anybody else want to jump in on this one?
Hi, Wendy, I'll jump in. I think also in looking at the demand, we understand that demand is plentiful, but as we reflect on the field, we also understand that there is a need to actually educate others about who chaplains and spiritual care providers are and what they do. And so this plays out in many different ways depending upon the areas in which we're serving. For example, with the Boston Marathon bombing, you know, there was a situation there that, you know, we weren't expecting a bombing, right? But when we had a group of equipped disaster response chaplains ready to serve, that really was an education to our community of course, this is a very specialized spiritual care skill set that we as a city weren't aware that we had and that we needed. And so as we're looking at dynamics of supply and demand, we're also looking at the fact that spiritual care providers and chaplains are really underfunded within systems to do what we do. And so as practitioners, we have to survive, right? We have to be compensated for what we do. And so the conversation around supply and demand also gets at those other nuances of the need for educating, you know, other disciplines and sectors of the society that we are here and that we're already providing the service, and that the services are needed, and that spiritual care is a human right, you know. And so all of these things are interacting together when we talk about demand centered versus supply centered. Now, as a college chaplain here in Berea, Kentucky, I'm blessed to work for an institution that since 1855 really had worked into its structure that spiritual care and chaplaincy is important for students, right, as a support. And so I recognize that as a college chaplain here, that the supply-demand conversation is nuanced, slightly different because of that history. But also as a college chaplain here, something that we look at with supply and demand is that we need chaplains here that understand the relevance of adverse childhood experiences because of the populations in which we serve, right? So we're also getting into the nuances of our specialties as spiritual care providers and how we're educated, how we acquire that knowledge, and what special skills that we're able to bring into different environments.
You know, one other thing I just wanted to jump in and say, you know, as I think about the field beginning to diversify, you know, just a couple of examples that came to mind, much like the one that Dr. Wright mentioned in terms of the Boston Marathon bombing, the spiritual care providers who worked around that situation. But, you know, I'm thinking about now that we are in the midst of this uprising as it pertains to the traditional ways in which this country has dealt with issues of race. You know, one of the things that I'm starting to hear more and more about are movement chaplains. So chaplains who are providing spiritual care to the people that are on the front lines of these very, you know, these crucial movements. You know, and so that to me is an example of the demand, you know, directly influencing the supply that's out there. You know, there's a demand for this, there's a call, there's a need for it. And so therefore we need to figure out ways for this field to be nimble enough that we can, with integrity, you know, as Allison mentioned, you know, with integrity, find and figure out supply chains and ways of training and equipping people to go out and meet those demands. You know, another thing that I'm thinking about prior to returning to Brown as an associate dean, I served as the chaplain to the Institute and the director of the Office of Religious, Spiritual, and Ethical Life at MIT. And you know, one of the things that I found in my time there that was very important was to figure out what was the need on the ground and how can we begin to equip our office to meet that need within that particular higher education setting. And so, for example, one of the things that we found was that we were not meeting the need of a large percentage of the students, faculty, and staff because many did not identify as religious and therefore would not have set foot into our building, which was called the, you know, the Religious Life Center, because they didn't think that it applied to them. Now they still had all of those same, they were wrestling with those same questions of, you know, of grief and loss and meaning making and all of those types of things that we as human beings wrestle with, but they didn't want to do it under the traditional understanding of religion. So therefore, you know, we did a number of things, but, you know, for example, bringing on board a humanist spiritual care provider who could work with the students, faculty, and staff who identified as non-religious. So to me, that's another way of thinking about a demand-centered model. You know, how can we make our spaces of offering services and support meet the needs that are presenting on the ground?
Thanks for that example. I wanted to jump in here also because there were some questions about whether design thinking can help sometimes in assessing demand, and I think the answer is yes. Sam Spears and his team at Vassar College.
1411243033876.
Oh dear, I don't know where that is, but if somebody can turn it off, it'd be awesome. I think Michael's trying to still get Eric in. So Sam Spears and his colleagues at Vassar College engaged with Hillel in a design thinking exercise where they did, Kirsten, exactly what you're describing, trying to figure out who they were serving and who they were not serving. And they actually remade their entire department as a result. And we're in the process of developing a case study about them that will be available on our website for free, that we're hoping will help other institutions and people begin to think about demand. I think the easiest way to figure out how to talk the demand language is to think about what your institution needs and figure out how to talk in that language. And it's very often not religious or spiritual. And if we can talk in that language, that's how we get grants through the chaplaincy lab. We say there's a problem X, and we think chaplains might be able to be helpful with that problem. We see that there's a problem with isolated elders, and social isolation is a problem nationwide, and it has catastrophic consequences. And we think chaplains can make a real difference there by beginning to do some visits with elders that we can measure the effectiveness of, and then we might be able to scale. We're not saying a word about religion or spirituality explicitly, we're talking about how to meet demand. So let's turn, and this came up before, but a lot of questions about how you all imagine best diversifying the profession, how to address many of the really complicated pipeline issues. One person has pointed out that there are many more people of color in chaplaincy than there were 30 years ago. That's true. I also think it's not enough. And I'll put the best paper we have about the demographics of healthcare chaplains in the chat in a minute, where we can see that there are more people of color who are CPE students than CPE residents, fewer CPE residents than CPE supervisors. So I wonder, and I've thought a lot about this, I outlined some of my questions in a letter that went out to the lab last week, of what our visions are for sort of addressing these challenges, because I'd love to try to bring some money and resources to this really central issue. Anybody have a plan, a thought, a suggestion, something that doesn't work?
Well, I think, am I muted?
Nope, we're hearing you.
Oh, okay. I think one thing that we need to consider is mentoring. I know that I would probably not be in this field today if it were not for the support of some outstanding mentors who, kind of saw in me, I guess, what I wasn't necessarily seeing, and were able to orient me to a field that I had no prior understanding of. So I think that that's one huge area that a focus that's important.
I've wondered if anybody knows a donor about whether we could build two programs. One is I want to build a program for people who are in their first year of a chaplaincy position, a staff position anywhere, and let them be able to connect with one another in a cohort as well as with more experienced chaplains, because I think that movement into your first chaplaincy position is a really big transition and support would help. I also really want to network all of the theological students. So we know that a quarter of theological schools have some sort of a degree program in chaplaincy or spiritual care. Often there's just one faculty member there, and I have a dream of a cohort program where people can apply for a year or two to be a part of this program, and maybe there's programs, I don't know, monthly or quarterly, just to gather together people who are exploring chaplaincy as a vocation and let them hear from a port chaplain and an airport chaplain and someone who works in retirement, sort of see the scope. So those are two of the things I hope eventually that we'll be able to do through the lab. If people have ideas or resources or suggestions, we'd love to hear from you. Eric, we have you.
I'm here. Can you hear me?
We can hear you. We can't
All
see
right.
you, but we can hear you.
Here I come.
There you are.
Welcome. Thank you. Great to see everyone. I'm sorry for whatever's going on. I'm not quite sure. Got 4 laptops here. Hey, I just heard you talking about training, about the education of chaplains, and I had a wonderful conversation. Actually, Allison and I had this conversation in Michigan in December, and ACPE put me in touch with a rabbi in New Jersey, and we're talking about we're getting ready to start our 3rd cohort of public safety chaplaincy certification at an Lutheran Theological Southern Seminary in Columbia. And one idea is to do 8 seats in a online CPE extended unit blended with our traditional in-classroom program that we've been doing so far. So I'm very excited about that, very excited. I missed part of the conversation. I did want to say something about demand, if that's okay. Y'all, if you have watched the Chaplaincy Innovation Lab website, you saw Shelley Rambo wrote about the anniversary of the shooting at the Mother Emanuel Church in Charleston. And in our work in public safety, we were involved in that incident over the last 5 years we've been involved with it. But it was interesting to me when the trial came up, that we were involved on the front end, following up with public safety who were involved hands-on with the victims and the family members, the crime scene people, the local and state police and FBI. But when the trial came up, the U.S. Attorney's Office, this was the origin of the call. They made contact with our office and said, hey, we're trying to care for these church members, these family members, these victims and survivors during the trial. Would the chaplains be part of, it's like a three-legged stool. Would you be part of a team approach where you had victim advocates, where you had mental health professionals, and you had chaplains? And that's exactly what happened. And anyway, it was such an innovation. The U.S. Attorney said that's the first time the Justice Department had ever approved something like that. But anyway, just they called us. We didn't call them. They said, come help us. So a small picture about demand.
Thanks, Eric. Is there more you want to say, or shall we go back to the questions? I really appreciate you getting on here and adding to the demand piece of the conversation. Sure. Just to say that it is a very curious time between the time that we plan this webinar and what's going on today. As you can imagine, working with public safety, we are facing all kinds of challenges in the population that we care for and support. And from the frontline officers to the family members of those officers to the stress this is causing at home with public safety. I don't have much political to say about that, but I do have a lot of pastoral things to say about it, that it's a very difficult time for the folks I work with. Mm-hmm. So. Mm-hmm. Thanks, Eric. I appreciate that. A lot of questions coming through. We haven't talked much yet about resources. So thoughts that people have about how to make the case to supervisors that chaplaincy is worthy of the budget. Some questions also asking about how we can attract younger people into chaplaincy when the pay is poor. I can say we're this month finishing up a project where we interviewed healthcare executives about how they think about chaplains. Again, on the demand side, we wanted to hear how they make decisions about resources. And part of what we learned is that they don't know much. They tend not to use data or even be aware of very many studies about chaplains, and mostly stay with the status quo, which means that it's incumbent on managers to report up the data and make the case, but I don't think we train them how to do so. So I'm not saying that that's the answer, but do any of you have thoughts about the resource issues, trying to get resources, working with supervisors outside of chaplaincy, et cetera?
I think that it's very important to find out what the language is of the institution that you're serving in. And what I mean by that is, the things that are important to your supervisor, to their supervisor, to the board of directors, and then make the case, how funding your area of chaplaincy can contribute toward them working towards those goals that they're already trying to meet. To me, that's been what is most successful. In higher education, one of the crucial issues that we're dealing with, has to do with mental health and wellness. And so that was what I found, was the best way to make the case for additional resources, toward chaplaincy, was identifying and being able to support with data, how funding that particular department was going to contribute toward a measurable response to the mental health crisis on campus.
I think also.
Please go ahead.
Go ahead, Allison.
Well, I was just going to say, I lost my train of thought, so you go ahead. It'll come back.
Oh, I'm sorry. I was going to say, we also can learn from public health as a discipline. Spiritual care providers and chaplains really primarily provide primary prevention. And there's a lot of literature out there about primary prevention. The language of an ounce of prevention is worth a pound of cure is actually the truth, right? And so if we start looking at budgets, and if we can show monetarily how building the primary prevention infrastructure of the organization or city or whatever it is actually will save money on the back end, then most people are willing to look at that and listen to that. And there's a lot of literature that supports that. And so I would recommend using the literature that's out there to help make the case.
It came back to me. So, and I think it aligns with some of what's been said, but so all of these different things we're talking about, I don't know if all of you who are, watching this webinar are feeling exhausted, right? I think we all are feeling exhausted with everything that's going on right now. And in the nature of chaplaincy, right, we would be working against our true nature to attempt to do everything and to attempt to pursue any one of these things, whether it's resource development or all the things we've mentioned, and not find a way to be sustainable. So I'm just thinking about, how can we work on these kinds of things as teams? There are just going to be some chaplains that are better at resource development than others, some that are actually going to be more tied into understanding what diversity means and how you integrate it with training, those kinds of things. So I just would say that, I don't think any one person is being asked to do any of these things on their own, though I think sometimes we feel that way, and some days it feels like it. But if we can continue to find ways of, kind of creating these networks, like I was so grateful that Eric kind of reached out and was said, wow, we can do online training in CPE, right? And then that it wasn't, although I wanted our program to do it, we weren't the right fit, but to be able to make those kinds of connections. So more and more to collaborate.
Mm-hmm. So let's go to one last question. It's a hard one, so everybody get ready. It's been asked in a couple of different ways by different people in the chat box. The question is how, particularly in the current moment, those of you, not me, who do the work of chaplaincy, do it when you are in a setting and particularly with people with whom you strongly disagree. So there are some people asking about how chaplains dedicated to social justice work do this pastoral care work when they're in a setting with people who disagree. I imagine this is a challenge for some social movement chaplains, for some police chaplains, for some healthcare chaplains. I mean, there's a great conversation going on in the private Facebook group. I can put the link here amongst people connected to the lab about what you do. I think it started out with the question in a healthcare setting, but now there's a separate conversation about prisons. What do you do when people say racist things? And I wonder if any of you could speak to that. And then we're going to turn it to Kirsten for a moment to close.
Okay, I'll try to interject a little about that. In my role at Berea College as a college chaplain, we were founded by Christian abolitionists John and Matilda Fee. And so within our structure, we have great commitments, which are part of our mission. And when I run into difficulties, whether it's about the issue of race that has come up in the question or other areas where there might be disagreement, it helps to go back to the founding mission of the organization, of the group, and use that as our place of common ground. And so we see that in various movements within the United States that refer back to the Constitution. And, you know, keep in mind that, yes, at that time when this was created, we know that not everyone, you know, was included in this, but guess what? Everyone is included in this, right? And so I would say in difficult times where you have disagreements are going to come. It's human nature. But I think if you can go back to your founding guidelines, the principles that guide your organization, and try to find common ground there, it will help you have a springboard to work from.
I think also too, acknowledging that there's a place for inter everything encountering, right? Just to encounter others that we do not agree with or don't agree with us. But that sanctuary is also really important. And I don't want to overplay sanctuary, because then, you know, that kind of brings us back into ourselves, or to, you know, just isolates ourselves within our own communities. But just recognizing with that's a real need. I mean, I'll speak for the Jewish community. Well, I shouldn't speak for the whole Jewish community, but we recently, in collaboration with Neshama, which is the Association of Jewish Chaplain, we did an online CPE unit that happened to be for Jewish students. It could have been open to others, but that's who came. And NAJC helped to support that and helped with recruitment. And while I wouldn't recommend that every Jewish student do all of their CPE in a Jewish cohort, there was actually quite a lot of healing that was able to happen, that the students reflected on now being able to go back out into their interfaith setting and feeling strong. So I think, you know, we don't want to put too much emphasis on that, as not to isolate, but I think just knowing that we do need, you know, some sanctuary and places to strengthen ourselves, but also to continue to encounter those others even when we disagree.
Thank you. And thank you again to all of you for being here and being with us. Thanks to Fetzer for partnering on us in this conversation. There I am, sorry. As Michael mentioned, this will be recorded and we will send it to you with the ebook. LeSette, some people have asked for your prayer, if you would be comfortable sharing that. We're happy to hear from any of you and want to do all we can to continue to serve you. With that, Kirsten, you want to have a moment to wrap us up?
Yes, absolutely. Just again, thank you to everyone who was here this afternoon, to my fellow panelists, Wendy and Michael also. I just wanted to share something. It's a quote that I feel really kind of embodies what chaplaincy can be in this moment. You know, this moment of multiple tensions and pandemics. You know, as we are still, as Ram Dass says, journeying to walk each other home. So this quote is by Judith Zimmer Brown, who is a professor of contemplative and religious studies at Naropa University. And it simply says, "The purpose of our human life is huge, to grow larger hearts and open minds. We celebrate that we can do that in this moment." I'll read it one more time. "The purpose of our human life is huge, to grow larger hearts and open minds. We celebrate that we can do this in this moment." And as I leave you all with that thought, I hope that you can take that throughout all of the work that you're doing.
Thank you so much.
Thank you, everybody. Keep an eye out for the link with the recording and the ebook, and we will see you on the next webinar. Thank you for joining us.